Okay, let's unpack this. Welcome to the deep dive. We've got quite a bit of material here, articles, research bits, all digging into something super common. You might even have it at home right now. Insecticides.
Specifically, we're looking at pyrethrins and pyrethroids.
Right. And our mission really is to go through this material, understand what these chemicals are, how they affect animals,
hmm
and why some animals, particularly cats, react so differently.
And crucially, how to prevent problems. That's a big part of what these sources cover.
Exactly. Because what jumps out right away from these sources is, well, kind of shocking.
Hmm.
A product made to help one pet could be the biggest danger to another, especially cats.
Yeah, and the why is fascinating. It's down to their basic biology.
So this deep dive is really about arming you with that knowledge, making sure you know the risks and how to keep your pets safe.
Definitely. We're talking about chemicals used everywhere, very effective against insects, targeting their nervous systems.
But the risk to pets comes in when they're misused, right?
Yeah,
Or with certain animals.
exactly. When used correctly, the risk is generally lower for mammals, but the sources stress that misuse or exposure in sensitive species, that's where the serious issues come up.
Okay, so let's start with the basics. What exactly are we dealing with? The sources mentioned two types.
You got pyrethroids, those are the natural ones from
Right.
chrysanthemum flowers,
Okay.
and then pyrethroids, those are the synthetic ones. The sources say there are like over 1,000 different synthetic versions out there.
Wow. Why so many?
They're engineered to be more stable, last longer, and be more potent than the natural pyrethroids.
Gotcha. Any common names we might recognize from labels?
Oh, yeah. You'll see things like permethrin, that's a big one, deltamethrin, bifenthrin, cypermethrin, etofenprox. Those pop up a lot in the sources.
And how do they actually work? You said they target the nervous system.
Yeah, that's their main target, insects or mammals. They mess with sodium channels in the nerve cells, the axons.
How so?
They basically force those channels to stay open longer than they should. It causes the nerves to keep firing over and over again.
Like a jammed signal or a stuck button.
Exactly like that. Leads to overstimulation, tremors, all those neurological signs we'll get into.
And the frequency of this.
Yeah,
The sources had some numbers, right?
they did. Pretty striking, actually. These exposures, pyrethrin and pyrethroid related, make up 45% of all insecticide calls to the ASPCA Animal Poison Control Center.
45%. So this isn't some rare thing. It's like really common.
Extremely common. Vets deal with this a lot.
Okay, so they affect nerve signals, exposure is frequent.
Yeah.
But you said not all animals react the same. That seems key. Who's most at risk here and why?
The sources are crystal clear on this. Cats. Cats are uniquely, profoundly sensitive.
Right at the top of the list.
Absolutely. But it's not only cats. Small dogs, the very young or very old pets, animals that are already sick or weak, they're also at higher risk.
Any other factors?
Yeah, the sources also mention animals with lower body temperature, maybe after a bath or coming out of anesthesia. They seem to be more prone to showing signs if they get exposed.
Okay, but cats are the main concern. Why? What makes them so vulnerable? The sources explain this.
They do, and it's really the core issue. It's about their metabolism. Cats lack efficiency in a specific detoxification pathway.
Detox pathway.
Yeah, specifically something called glucuronide conjugation. It's a biochemical step that other mammals, like dogs, use really effectively to break down these chemicals and make them safe to excrete.
And cats don't have that.
Yeah.
Or it's weak.
It's significantly less efficient. They just can't process these compounds as well. So the toxic byproducts, the metabolites, they hang around much longer in a cat's system.
So they build up.
They build up, right, leading to prolonged exposure to the nervous system and much more severe signs, even from a dose that a dog might barely notice.
So it's not just size, it's this fundamental metabolic difference. Wow.
Exactly. And then there's their behavior.
Grooming.
Meticulous grooming. If they get any of this stuff on their fur, even a small amount, they will ingest it while cleaning themselves. That just adds to the dose their system is already struggling with.
Okay, that makes sense. What about dogs then? We see for dogs on so many products, are they basically in the clear?
Generally, yes. If the product is used exactly as the label directs, their metabolism handles it much better.
But not totally immune.
Not totally. The sources do mention sensitivities exist, especially with certain compounds like bifenthrin. You often find that in lawn products. And obviously, misuse is still a problem.
Like using way too much.
Yeah, or using a product meant for a huge dog on a tiny one. That can still cause issues. They have more tolerance than cats, definitely, but proper use is still key.
Right. Okay, crucial distinction. Now, how does exposure actually happen? The sources pointed to one main way. especially for those really bad cat cases.
Yes, this is probably the most important practical point from the sources for prevention. The number one cause of severe pyrethroid poisoning in cats. It's owner error.
Owner error.
Specifically, applying a flea and tick product labeled only for dogs onto a cat.
Wow.
Yeah.
Using the wrong product.
It sounds so simple, but it's deadly serious. Dog spot-on products often contain way, way higher concentrations of pyrethroids.
Like how much higher?
The sources mention ranges like 20% up to even 85% pyrethrin in some dog spot-ons. A cat's system, with that metabolic issue we talked about, simply cannot cope with that level of toxin.
Okay, that's the big one. Are there other ways pets get exposed?
Sure. Environmental exposure is mentioned, indoor sprays, foggers, lawn granules.
Is that as dangerous?
Usually the concentration is lower, so the risk might be less than a direct spot-on misuse. But direct contact before it dries, or using products with potent stuff like bifenthrin, that still poses a risk.
So keep pets away until it's dry and aired out.
Absolutely. The sources strongly recommend that. Keep them clear until everything's dry and ventilated.
What else?
Accidental ingestion, pets chewing on the bottle or tube.
Oh, right.
And then there's this other route, which the sources flag as really important, especially if you have multiple pets. Indirect exposure.
Indirect. How does that work?
Okay, so picture this. You treat your dog with a spot on, then your cat grooms the dog. Or maybe they just cuddle up and sleep together before that spot on has fully dried on the dog's fur.
Ah, the cat picks it up from the dog.
Exactly. The chemical is lipophilic. It likes fats and oils, so it sticks to fur easily. It transfers from the treated dog to the cat through normal contact. Then the cat grooms itself and ingests it.
That's subtle, something you might totally miss.
Very subtle, but the sources highlight it as a real risk in multi-pet homes. It's not just about direct application to the wrong animal.
Okay, so lots of ways this can happen. If you suspect exposure, what signs should you look for? Do they show up immediately?
It varies. Signs can appear quickly, sometimes within minutes or hours. But, and this is important, the sources emphasize they can also be delayed, sometimes up to 72 hours later.
3 days. Wow. So you can't just assume you're in the clear after a few hours.
Definitely not. You need to watch closely for that whole period.
What are the early, maybe milder signs?
Things like excessive drooling, hypersalivation. Sometimes you see rapid paw flicking, like they're trying to shake something off. Ear twitching is common. Maybe some gagging or hacking, vomiting, diarrhea, mild depression or maybe agitation, hiding. These can happen in dogs or cats.
Okay, those are the warnings. What about the really serious signs, the emergency signs?
That's when you see things like generalized tremors, the whole body shaking, visible muscle twitching, like ripples under the skin, that's called fasciculations.
Okay.
Poor coordination, they might stumble or walk funny, that's ataxia. Profound weakness, disorientation, acting really strangely. Severe agitation or restlessness. And the big one, seizures.
Seizures sound incredibly serious.
They are. And you can also see breathing problems, respiratory distress, even fluid in the lungs, pulmonary edema, which can sometimes be delayed.
Oh, wow.
In cats particularly, all that muscle activity from tremors and seizures often causes their body temperature to shoot way up hyperthermia, which is dangerous in itself, though sometimes they can get hypothermic, cold, but that's less common.
And the worst outcomes.
Prostration, basically collapse, coma, and unfortunately, death is possible in severe cases.
That's terrifying. The sources also mentioned something about different patterns of signs, depending on the chemical.
Yeah, they noted that different pyrethroid structures, sometimes called type I versus type 2, can be linked to slightly different symptom clusters, like more tremors versus more writhing movements and salivation.
Does that change treatment?
It helps vets understand the picture, but treatment is generally supportive regardless. What's also interesting or tricky is that pyrethroids can interact with other nerve pathways too. Meaning the symptoms can sometimes look very similar to poisoning from totally different things, like organophosphate insecticides. Makes diagnosis based just on signs challenging sometimes.
Right. And you mentioned synergists earlier. Remind us what those do again.
Ah, yes, synergists like piperonal butoxide, PBO. They're added to products, but they aren't insecticides themselves.
So what's their job?
Their job is to block the enzymes that the animal's body normally uses to break down the pyrethroid. They inhibit the detoxification process.
So they make the pyrethroid stronger, more toxic.
Exactly. They potentiate it. A product with a synergist is more hazardous than one without, even if the pyrethroid concentration looks the same on the label. It basically overcomes the pet's natural defenses.
Okay, so knowing all the ingredients is critical. Given this complexity, how do vets pin down that it is pyrethroid poisoning?
History, history, history. That's what the sources emphasize. Diagnosis really hinges on getting a consistent history of exposure.
Meaning you need to tell them exactly what product was used.
Absolutely. The exact product name is crucial. What are the active ingredients? Is it pyrethrin? Is there a synergist like PBO listed? Was it meant for the species it was used on? The right dose for the weight? How is it applied?
And that story about using a dog product on a cat.
That's a massive red flag for a vet seeing a cat with severe neurological signs. It points very strongly towards pyrethroid toxicity.
Are there like blood tests?
Not really routine ones for pyrethrins themselves. The sources say some pyrethroids can be detected in tissues or even hair. Hair analysis for permethrin, for instance, might be useful if a cat is really sick, but the owner thinks the exposure was minor. It could confirm a high concentration product was involved.
Okay. And vets have to rule out other things too.
Definitely. Because the signs overlap with other toxins, organophosphates, carbamates, even strychnine or certain plants, they have to consider those differential diagnoses.
So bring the product packaging if you can.
Yes, that's invaluable information for your vet.
Okay, so let's say the vet suspects or confirms pyrethroid poisoning. What's the treatment plan? Is there an antidote?
That's a key point the sources stress. No specific antidote exists, none at all.
So you can't just reverse it.
No. Treatment is purely supportive care. It's all about managing the symptoms the animal is showing and helping their body clear the toxin.
What's the first step then?
Decontamination. If it was a topical exposure, getting that stuff off the skin is critical. Bathing promptly with a mild dish soap like Dawn in lukewarm water.
Lukewarm, specifically.
Yes, very important. You have to be super careful not to make them cold, especially cats or small animals, or ones already trembling. Avoid hypothermia. You might need warm towels before and after.
Okay. What about if they swallowed it?
Oral ingestion. Well, inducing vomiting might be considered sometimes, but often these animals are already showing nerve signs, which makes that risky. Activated charcoal isn't usually very effective for these toxins, according to the sources, so decontamination focuses heavily on bathing for skin exposures.
Then what?
Supportive care. 4V fluids are usually recommended for the more serious cases to help with hydration and circulation. Managing body temperature is vital, cooling them if they're hyperthermic from seizures, warming them if they get cold.
And controlling the nerve signs, the tremors and seizures.
Absolutely central. Muscle relaxants are key for the tremors. Methocarbamol is the drug of choice mentioned, given IV or sometimes orally. For seizures, they need anticonvulsants. Diazepam, maybe pentobarbital or propofol if seizures are severe or ongoing. Sometimes even inhalant anesthesia in really tough cases.
Is there anything vets should specifically avoid using?
Yes, the sources make a point of warning against using atropine. It's used for some other poisonings, but it's not an antidote here and can actually cause problems like rapid heart rate or even worsen CNS signs.
Good to know. Any other treatments mentioned?
There's mention of IV lipid emulsion therapy, or ILE, especially for severely affected cats where tremors are hard to control.
Lipid emulsion. Like fat.
Essentially, yes, an intravenous fat solution. The idea is that because these toxins are fat-loving, the lipids in the IV solution can sort of act like a sponge, pulling the toxin out of the tissues and into the bloodstream where it's less harmful, helping the body eliminate it faster. The sources suggest it shows promise for shortening recovery and hospital time in severe cat cases.
Interesting. And watching for complications.
Right. Monitoring for things like aspiration pneumonia from excessive drooling, kidney problems, or issues with blood clotting that can sometimes happen after prolonged illness or seizures.
Okay, so it's intensive supportive care. What's the typical outlook? How long does this last?
Prognosis really depends on how severe the signs are and how quickly treatment starts. But the sources generally state that most signs, mild or severe, tend to resolve within 24 to 72 hours with good vet care.
Okay, 1 to 3 days.
Yeah. Though hypersalivation, the drooling, especially in cats, might linger a bit longer, maybe recurring for several days if they keep grooming residual product. But for the really severe cases, with bad seizures or collapse, the prognosis is definitely more guarded. Prompt, aggressive treatment is vital for the best chance.
That time frame is useful context, and it really hammers home that getting help fast matters. But obviously, we want to avoid getting there at all. Prevention. What are the absolute must-do prevention tips from these sources?
Prevention is everything here, and the advice is very direct.
Lay it on us.
Number 1, proper application. Read the product label every single time before you put anything on your pet.
Seems basic, but crucial.
Absolutely. And the biggest one we keep coming back to, Never use a dog-only flea and tick product on a cat, ever.
That's the message that needs to be shouted from the rooftops.
It really is. It's the most common path to severe poisoning. Check the label, confirm it's for the right species cat or dog, and the right weight range for your specific pet.
What about those multi-pet homes? Dog and cat living together.
Big point in the sources. If you use a pyrethrin spot-on your dog, you must be mindful of the risk to your cat. Keep them separated after you treat the dog.
For how long?
The recommendation is at least 12 to 24 hours, basically until that spot-on is completely dry. Consider physical barriers too, like putting an old t-shirt on the dog so the cat can't lick the application site.
Smart. Any tips for applying sprays?
Yeah, instead of spraying right onto the pet, which can cause them to inhale it or lick it off immediately, spray it onto a brush first, then brush it through their coat. Less direct ingestion that way.
Okay. What about dips or pour-ons?
If you're using one that's labeled for that, and many aren't common anymore, pour it on the body and sponge it around. Never, ever submerge the animal in a dip. That's explicitly warned against.
Got it. And the environmental stuff? Lawn treatments, foggers?
Those are for the environment, not for the pet, unless the label specifically says it's okay for both, which is rare. After you treat the house or yard, keep pets completely out of the area until everything is thoroughly dry and the space is well aired out.
Okay, so the prevention boils down to read the label meticulously, use only species and weight-appropriate products, and be super careful about indirect exposure between pets.
That's the core of it. Follow those rules and you dramatically reduce the risk, and it bears repeating, if you even suspect an exposure, if you see any signs, no matter how mild, get the product info, call your vet immediately, don't wait and see.
Right. So this deep dive, we've seen how common these insecticides are, learned about that crucial metabolic difference making cats so vulnerable, and really understood that simple misuse, often unintentional, is the biggest driver of serious problems.
And knowing the specifics, the type of pyrethroid, if there's a synergist, that information from the label is power if you ever need to seek veterinary help.
Okay, here's a final thought for you, listening. We've just spent time talking about these chemicals, common things in our homes and yards, realizing how a slight difference in an animal's internal biochemistry, that one metabolic pathway, can turn a helpful product into a lethal threat. Well, what does that tell us about the complex, often hidden biology we coexist with every day? It certainly makes you think twice about reading every word on those tiny product labels, doesn't it? Thanks for joining us for this deep dive.